This class is Medicare Basics, all about enrollment and eligibility. And for everyone on Zoom, I am part of Senior Solutions. We're the Council on Aging representing Londonderry and the southeastern Vermont quadrant. Medicare is federal health insurance. It's administered by the Center for Medicare and Medicaid Services, and it's managed and you enroll through Social Security. The eligibility criteria for Medicare is that you have to be a U.S. citizen and 65 with some exceptions. Those who are legal permanent residents of the U.S. for at least 5 consecutive years, those people who are receiving disability benefits from Social Security for at least 24 months, and those that have a chronic disabling condition such as end-stage renal disease and ALS, sometimes known as Lou Gehrig's disease. Those are criteria for automatic enrollment. So Social Security determines your entitlement to Medicare. When we get a call at Senior Solutions that I'm turning 65, someone told me to call you to learn about Medicare, one of the first questions we'll ask you is, are you enrolled in Medicare, or do you need to enroll in Medicare? The way you enroll in Medicare, and what I have told people for 6 years now, is call Social Security in Rutland, and this is the phone number. For those of you watching this from Zoom or here, I will have this slide presentation available to anyone who has an email address that they provide to us on the registration. And you don't need to try and hurry and write down notes, because this phone number will come up a couple times in the slide presentation. So you enroll in Medicare with Social Security, like I said. You also do things with Social Security like update your address. So they always want to know where you are, whether you're here in Vermont or you moved to Florida. They will replace your Medicare card for you if you lose it or it goes through the laundry, like a few people have done. And they are also responsible for managing the payments of Medicare. They'll deduct it from your Social Security benefit, the premium. There's also a local office in Keene. Some people in our Brattleboro area, they're closer to the Keene office than the Rutland or Montpelier office. They can call there. Social Security has a website. They have been encouraging everyone to sign up for the portal access. You can do a lot of things on their website if you're interested in having an online account. I have heard people have found it very helpful to have an account. So Medicare, and this, I find this bar a little bit frustrating. Excuse me while I mute that. So most people must voluntarily enroll in Medicare during an enrollment period. So not everybody is automatically enrolled. There are some individuals that are automatically enrolled, and that would be because they are receiving an income, whether it be disability or retirement benefits from Social Security. If you're getting monthly payments from the office, they will issue you a Medicare insurance card automatically based on whatever your eligibility criteria is. So there are 3 enrollment periods. The initial enrollment period is when you first become eligible. There's a slide later on that sort of visually explains what the initial enrollment period is. It's defined as a 7-month period when you first become eligible. There's the general enrollment period. That's for those people who, for whatever reason, either chose not to enroll, didn't realize they could enroll, whatever. Every year, January, February, March is the general enrollment period, where if you didn't select Medicare during your initial enrollment period and you don't qualify for a special enrollment period, you would enroll during the general enrollment period. What's a special enrollment period? It's when you no longer have access to your group health plan through employment, your spouse's employment or your own employment. It's a special enrollment period. So again, to enroll in Medicare, if you're not automatically enrolled, you need to either go online or make the telephone call to request enrollment. It takes like 20 minutes to talk to somebody in the Rutland Social Security office. So automatic enrollment for those people who are receiving benefits from Social Security, you will receive a card that looks like this about 3 months before your insurance coverage begins. You should keep the card. Regardless of whether you accept Part A or B, you should keep the card. There's instructions in the packet that comes to you on how to refuse the Part B. Some people are employed, they're receiving their benefits, they're working, and they have insurance either through their employer or a spouse's, and they don't want Medicare. So there's instructions how you can refuse Part B if you want to. And then this slide is telling you the Medicare card should be carried in your wallet and or kept in a safe place. And underneath here on the screen that's not showing up because of my toolbar, if you need a replacement card, you can call Social Security, or the number listed on this screen is 1-800-MEDICARE. Either phone call will get you a replacement card. So this is what your insurance card looks like when you're eligible for Medicare. This number here on the screen, the Medicare number, used to be your Social Security number with one letter on the end of it. To protect your Social Security, they have changed the numbers. So it's alphabet soup. Medicare is really kind of feels like alphabet soup most days. So hospital Part A is the hospital coverage. If you're admitted to a hospital facility, you would be covered under Part A. Part B is the medical coverage to go see your doctor and things, outpatient care. You want to make sure the name on your card matches your Social Security card as well. They've been known to issue cards with wrong names, wrong birth dates. So you want to check that card when you get it. So this slide talks about the initial enrollment period. In this example, John Smith turns 65 in April. So his initial enrollment period, he can call Social Security January 1st, anytime up to the beginning of April, and his coverage would actually start April 1st, even if his birthday was April 30th. If I'm going too fast, someone give me some type of signal to slow down. And because of the nature of how we're doing this, everyone tuned in on the computer, I can't see you, so you may need to speak up. I see there's a couple chat messages that I will check towards the end. So if John Smith, turning 65 on April 30th, doesn't realize that he needs to call Social Security to ask for Medicare coverage, and he has a conversation with a neighbor and they say, oh, you need to call Senior Solution, whatever it is. If he makes that phone call in April, his coverage will start May 1st. And then there's sort of a delay. If he waits the remaining 3 months of his initial enrollment period, his coverage will start later. So in this example, because I like to see things, so there's a 3-month delay if he does not call and request enrollment into Medicare until June or July. There's a 3-month delay.
Are Are you accepting questions at this time, or should we?
I would, so this seminar is designed for a question and answer session after,
Okay.
because to some extent, I will answer almost every question you may have. The only questions I tend to not get to are specific to your situation, and then I welcome after the fact. If I've gone too fast and you're like, wait a minute, can you clarify that? Feel free to interrupt me, but I'm pretty certain I'll probably get to it, and then the question and answer, definitely. So there are two paths to Medicare. Medicare has the original Medicare that was designed in the 1960s, this A and B. And then there's also the Advantage plan. The Advantage plans are the ones that you see advertised on the TV all the time. And so we will talk a little bit about both options. So this little visual here, whoops, went backwards, sorry. So there are two paths to Medicare. There's original Medicare or the Advantage plan. Original Medicare is comprised of that Part A, the hospital. I also tend to call it catastrophic coverage. That's the one that pays the big bills, surgeries, and hospital stays. The Part B, the medical. And then there's optional coverage. And one frequent question is, well, if it's optional, why are there late enrollment penalties? We'll get to that. Optional coverage, there's Medigap. It covers in some of the gaps that you're expected to pay under the benefit program. And then there's the prescription drug plan. Medicare on its own, when it was first created, did not include coverage for medicines. So that was added several years ago. What was that noise? Are we still connected? So Medicare Advantage is private insurance. It combines both the A and the B through a private insurer, and most Advantage plans include the drug coverage. So this is kind of a la carte, A, B, D, and Medigap supplement. Advantage plans combines everything together. So you've got your medical, your hospital, and your drug plan. Oh, get my fingers off the button. So this is another chart, and this actually is, I believe, page 6 in the booklet that was handed out to you, this chart of how to understand it. So I inserted a few pieces of information. The Part A here is free based on your work history for most people. If you work for 10 years paying into the Medicare savings program and the Medicare trust fund, I think it is, your payroll taxes, you earn the Part A at no cost to you. I believe if they tell you you have to pay for it, it's valued at $471 a month. So that's what your payroll taxes are paying for. Part B, there is a fee for, and for this year it's $148.50. And then this optional Part D ranges in cost. The lowest cost for this year is $7.20. I have not even seen the 22 information, so I'm gonna ask about borrowing his book at the end of the session. But drug plans, it's in the very back of the book. The last 5 pages give you the pricing for next year. If you wanted to look in the handbook, page 125 is where most of the drug plan options are. So there are a couple plans that cost more than $88 that I put on here. I've never suggested anybody enroll in one of those plans. We always look at what's best for your pocketbook. And then the supplemental coverage, the cost varies because they are private companies. The cost varies. The average right now is $175. So Medicare Part A, what does it cover specifically? It's the hospital portion of your insurance. It does not cost you anything if you work for 10 years. you've paid for it, but there are co-payments involved, so no monthly premiums. It covers inpatient care, it covers blood, covers a skilled nursing facility stay, or some people say rehab. That might be like staying a week or two after a major surgery. And this slide, if I move it up, is telling you it also covers home health and hospice care. That's your Part A coverage that's free to you for working and paying into the trust fund. So with Part A insurance, it's a federal program. You can go to any provider that accepts Medicare. The cost to you in 2021, I jumped ahead of my information a little bit. It's free for most people. You do have a copayment if you are admitted to the hospital of $1,484. So that's the part that's not free. There are additional copayments if for some reason you were in the hospital for more than 60 days. But the benefit period, there's a $1,484 copay. There are different costs for other Part A services, and the supplemental insurance policies that we talked about, they pay those fees for you. That's the main reason why people buy them. So hospital inpatient again, the inpatient, you can call it a deductible. I think of it as a copay because it can occur more than once a year. We often think of deductibles as an annual thing. But in Medicare, they define it as a 60-day consecutive period of time. So it pays 100% at a nursing home, a skilled nursing facility for rehab after a 3-night stay in the hospital. You would be able to have up to 20 days recovery time in a rehab facility at no additional cost to you. After 20,
Could you go back to the hospital inpatient?
Yes, I can, and we, yep, let me see. So,
The slide that you had up there, I just had a question about.
I have this one.
Yes.
Okay, yep.
Co-insurance of $371 a day, does that mean?
That's if you're in the if you're admitted to Dartmouth Hitchcock Hospital or Grace Cottage Hospital or Springfield Hospital and you're in there for 63 days, your copay is going to become $371.
Okay, that's what I was curious.
Yeah, so I don't know if you've known anybody that's had, other than maybe in the pandemic recently, that's been in the ICU or something for more than 2 months. So it's fairly rare, but it can happen. And that would be another reason, I mean, that's one of the quote-unquote gaps in coverage, that you would be expected to pay this amount under this coverage. A supplemental plan that you purchase for $175 would pick up those copays. So, so I was starting to say, if you were in a skilled nursing facility and 20 days wasn't quite enough, you would have a copay of $185.50 if you did not have supplemental insurance. Most people are ready to get out of a rehab stay after 2 weeks, but there are those that need a longer stay to be ready to be home and independent. So that's Hospital A. What's a benefit period? The benefit period is how Medicare measures the use of that in-hospital patient and skilled nursing services. It begins the day you're admitted and ends the day you have not been in the hospital for 60 days in a row. So I have helped a few people that have been in Bay State Hospital in January, and in February they're at their local hospital. That is within the 60-day period, so there's only one fee for that because it's the way they structure that benefit period. After you have met your deductible, the original Medicare benefit pays in full for the days 1 through 60 that you're inpatient. So the deductible is that $1,484. So Part B considerations. I had a hard time when we were doing this slideshow, sort of where to put this in. This is about people who are working when they're 65, they have insurance, and do I keep Part B or do I decline Part B? So Part B considerations. If you are 65, you're covered by a group health plan through employment of you or your spouse, and you're working, you may delay enrollment into Part B if your company has more than 20 employees. If it's a small 5-person operation, you could keep your insurance, but you would need to enroll in Part B as primary care. The special enrollment to enroll in Part B, if you were to decline it during your initial enrollment, once you no longer have a group health plan from employment, you have 8 months to get enrolled under a special enrollment period. So I wouldn't want to go without insurance, but you do have an 8-month period of time to make that decision and get it connected and up and running. The general enrollment period I mentioned earlier is January, February, and March. So January 1st to March 31st. You can choose to enroll in Medicare if you declined it during your initial enrollment period. There is a late enrollment penalty if you don't have any insurance and you choose not to enroll in it, and it does happen later down the road when you make the decision to enroll. There's a 10% increased premium, so sort of a surcharge, or what they call it, a late enrollment penalty for each year that you went without it. I have assisted people who have been without it for 5 or 6 years. So their premium is 50 or 60% higher because of that. So this slide talks about Medicare Assignment, and it's whether a provider accepts Medicare or not. When a provider accepts Medicare, Medicare pays the provider 80% of the approved amount of the bill, and you are responsible for a 20% co-insurance or co-payment of the approved amount. So if a bill is $200 and that's the approved amount, your 20% share would be $40 for that bill. Sorry. So Medicare Part B. Medicare Part B pays for doctor services, outpatient care, home health services after discharge from a hospital stay, durable medical equipment, and preventative services. I have a booklet with me today on the back table that specifically talks about preventative services that you may be interested in taking. So here again is the initial, this is the slide for the special enrollment period. So John Smith retires this month. He has 8 months after he retires to enroll in Medicare. Usually no late enrollment penalties. Every once in a while we come across someone who should have been in Medicare, their insurance wasn't approved by Medicare, and they're socked with a you should have enrolled, that 20 employee rule. But usually when someone gets a bill from the doctor, they find out really quickly that, oh, you need primary insurance because all you're giving us is secondary insurance. We will help talk you through your particular situation when you call and ask for a counseling session. So if you enroll during a Medicare special enrollment period, you can enroll in an Advantage plan that replaces your Part A and B, or You can keep Part A and B and enroll in a D, and then also enroll in a supplemental plan. You have 6 months from the time you join Medicare, whether it be through your initial enrollment period or the special enrollment period. Once Part B becomes effective, you have 6 months to decide on the supplemental options available to you, because at that time, they do not look at your health history. It's called medical underwriting. So those with a chronic condition, they'll say a pre-existing condition. Medicare doesn't allow companies to consider that. When you're first joining Medicare, you're like a Medicare baby. You have no pre-existing conditions on paper. They can't ask you health screening questions. You can purchase any policy you would like. So in 2021, about 72% of the people on Medicare pay the $148.50 premium that I mentioned. A few people have higher incomes and they're charged a higher premium. So the higher premium, so if your individual income is between $87,000 and $109,000, you would be charged $207.90 a month instead of the standard $148.50. So it is a little bit of a sliding scale. This is referred to as IRMA. It's the Earned Income. I just know it as IRMA. Federal and state programs. It's all about acronyms. So it's the income adjustment. So original Medicare Part B covers those previous services that I mentioned, and then this slide is moving on to the drug coverage. Drug coverage is provided also by private insurance companies. They set their own premiums, they set their own co-pays. Medicare says they cannot charge more than a maximum deductible. In 2021, the maximum deductible was $445. So these companies charge a monthly premium. It varies by the plan that you choose. Some plans, mostly Part C plans, those Advantage plans, charge no premium. The annual deductible, I'm sorry, those chimes, I at first thought maybe somebody was disconnecting. I think they're incoming emails, so I apologize. The annual deductible varies by the plan, but it cannot be more than $445. Some plans do have no deductible, or they might have a $200 deductible instead of the $445. Those plans usually charge a higher monthly premium. The out-of-pocket costs are your co-payments or co-insurance. You may or may not have heard of the Medicare donut hole. That term refers to the drug coverage and this complicated formula of how the drug coverage is administered. What I'm going to cover in the next 5 or 6 minutes may sort of muddy the waters. When it comes down to it, we talk to you about the medications you take and what you can expect to pay. And sometimes the donut hole and the coverage gap and the catastrophic coverage doesn't come into play. If you're taking generic medications, you won't even have to worry about the deductible. So I don't want people to get anxious about it, but there is this thing in Medicare, the coverage gap, and this image sort of explains that. So at the beginning of the year, you are in the deductible phase. The plan pays nothing while you're in the deductible phase, but it's only applied to certain medications, not all medications, and that's why it's so confusing. You pay up to your deductible amount, so 100% of $445. Then you go into your initial coverage phase, which for some people is in February or March. Some people, the initial phase begins January 1st. The plan will pay 75% and you pay approximately 25%. Then you go into the donut hole, the coverage gap. That begins after the cost of your medications, what the insurance has paid and what you have paid comes up to $4,130 total. So it's not that you have to pay that much, but the combined cost of your medications, if you hit that amount, you're in the so-called donut hole. That's where supposedly the plan pays nothing, and you pay a set cost, 37% of generic drugs, 25% of brand name drugs. And after you've spent an additional $1,000 approximately, then you go into the catastrophic coverage phase, where the plan starts to pick up 95% of the costs and you pay a set small fee for your medications. Probably 1 out of 10 people that I counsel every year is affected by this, where they are in the coverage gap for 3 to 4 months of the year, and in November or December they come out of the coverage gap. So it does happen, but it doesn't affect 8 out of 10 people in this room. It might affect 2 of you, and that's again where my coworker and I counsel you on what options there are to deal with that. So this is another basic chart that describes exactly what I just talked about with that donut image. So you pay a monthly premium. This talks about 27 different plans because that's the Part D. There's an additional 19 options with the Part C, those Advantage plans. And again, most of them don't charge a premium. So for 27 of the different options, you pay a premium of those amounts. You have phase 1, the initial coverage period. You have phase 2, the deductible period. Phase 2 is the initial coverage period. Phase 3 is that coverage gap. And I'm looking at this slide and realizing my figure on the other slide may have been outdated. The out-of-pocket would come up for 2021 to $6,500. And again, that's not what you pay, that's the combined cost of your medications. And then phase 4. So same information, just a different format for people to try and absorb. So late enrollment penalty I talked about. So enrolling in the prescription drug coverage is also optional. Most people are encouraged to do it to avoid a late enrollment penalty and have coverage. So this slide talks about the late enrollment penalty. And again, if you have coverage through a group health plan, you don't have to worry about late enrollment penalty. It's for people who are choosing to not have insurance. I don't take any medications, I don't want to pay for insurance. Why do I have to pay for insurance? That's your choice. Here's the information that you need to know if someone were trying to decide whether or not to enroll in it, what their costs are down the road. So the late enrollment penalty that Medicare calculates on your behalf is 1% of the average premium. So for 2021, it's $33.06. So 1% of the average monthly premium multiplied by the number of months you may have chosen not to enroll in the plan. Occasionally some people forget to pay their bill. They get dropped from the plan they enrolled in, and they are without coverage for 8 months or maybe 3 years. So it's the number of months that you could have had, should have had coverage and chose not to, then becomes your monthly penalty or surcharge. That is charged on top of your monthly premium for the duration, the remainder of your days. So here's an example. Mr. Smith joined a drug plan at the end of his initial enrollment period in February of 2017. However, he chose to disenroll from that plan at the end of the year. He joined another plan 1 year later in 2019. His coverage with a new plan began January 1st, 2020. Since leaving one plan and joining the other, that was 24 full months that he chose not to have coverage. Therefore, starting with his new coverage, he would pay 24% of the monthly premium, an average. So this looks like maybe my figures are outdated here too, but Mr. Smith's penalty is approximately $7.86 every month. Rounded to the nearest tenth means every month he'll have a premium bill of whatever his premium is, plus $7.90 to pay back for those months that he wasn't enrolled in the plan. So if your premium would have, if Mr. Smith had, his plan was $32 a month, he went 24 months without paying that $32, hopefully because he didn't need medications. So now when he's re-enrolling, he's going to pay an extra $7.90 a month for not having the coverage. So now at this point in the presentation, I'm going to start talking about the private, the Medicare Advantage, sometimes called Part C plans. So Medicare Advantage are private plans through private companies approved by Medicare to offer the coverage that effectively replaces Part A, Part B, and Part D. They provide all of your coverage. They must cover what original Medicare would cover. That is defined as medically necessary. So your doctor decides if it's medically necessary. It includes prescription drug coverage. And some plans also offer benefits such as vision, dental, gym memberships, over-the-counter medications, transportation, personal response buttons. Those, the Philips Lifeline is the common one advertised on TV. Help, I've fallen, I can't get up. Some plans advertise that they, in addition to paying your doctors and medical folks, will also pay for those extra benefits. Original Medicare does not cover vision, does not cover hearing, and does not cover dental. So some of the new private plans say that they do. They have a different cost structure. There's no standardization to them. And original Medicare will continue to pay your hospice benefits for anyone that's in a private plan and ends up enrolling in hospice. Original Medicare still provides those services. So the Advantage plans, sorry I keep touching the wrong thing. Advantage plans work on a network format, so that you have to go to a provider that's in the network for them to pay the bill. They may or may not have an additional premium above your Medicare premium, and they do have co-pays and things that vary slightly from original Medicare. And again, they do offer some vision, dental, and hearing benefits. So there are 4 different types of plans. There's actually a couple of these are not offered in Vermont. The HMO is the Health Maintenance Organization. PPO is Preferred Provider Organization. Private Fee-for-Service plans, and the Special Needs plans. I don't believe there are any special needs plans, and I don't believe there are any private fee-for-services. I haven't seen what's available for 2022. So when you are in Medicare, and you may be starting to hear about this now, open enrollment. So I just want to move this. So open enrollment is when you are on Medicare. So the individual filming us today, he is enrolled in Medicare. He has received his 2022 handbook, and open enrollment begins a month from now, 3 weeks from now, where you can look at next year's options, decide if the one you're in is where you want to stay, or if you want to pick a different option for next year. So it begins on October 15th, and it continues for 7 weeks until December 7th. And any changes you make to your coverage take effect January 1st. So as a recap to that, so our office can be reached by most local phone numbers by calling the number on the screen. That is a statewide number. So if you were to tell your sister in Burlington to call this number to talk about Medicare, your sister would get the Burlington counterpart to us. So that's a statewide number. It's tied to the area code that you're calling. So 824 in Londonderry would get our office. 1-800-Medicare also does insurance counseling. I tend to say we're friendlier. But you can, the advantage to calling 1-800-Medicare is they answer the phone 24 hours a day, 7 days a week. I only pick up the phone from 8:30 in the morning till 4:30 in the afternoon. I think I'd know my slide titles by now. So, original Medicare with the Medigap. And I want to point out that Medigap is a kind of a cutesy name for supplemental insurance. We get a lot of phone calls telling the people who answers the phone, I want to find out about supplemental insurance. Well, what they really mean is drug coverage and all the stuff to go along with A and B. But Medigap and supplement is specific to extra insurance to pay your out-of-pocket costs. And I brought with me today, that's on the back of the table, a booklet specifically shopping for Medicare supplement insurance. It's a booklet back there. It's actually got 2017 on it, but that's the last time they produced it. And they don't mail it out. You have to order it special, and it's all the correct information in it because there is no pricing. It's just all about how to figure out what you want and what works for you. So I encourage you to take one of those books.
Is that information available online?
It is. All of this information is available. Medicare has a great website, and they might even actually have one that says 2020 online. But the last one they mailed to us was 2017, and since it's not priced, it just has the information in it, we still have them rather than recycle them. So the supplemental insurance is offered again through private insurance companies, many companies that you recognize and have done business with. They cover the costs that you would normally be expected to pay, specifically that $1,484 deductible if you're in the hospital. They again are advertised, organized alphabetically. So again, alphabet soup. So Medicare is Part A and Part B, but there's also supplements A and B. And so the terms can be confusing, and I say that's job security for me to help you understand it all. So there's 4 basic benefits to a supplemental plan. They pay your co-payments or co-insurance for the Part A services, the Part B services, and also I haven't quite figured out the whole blood thing, like why they point that out, but apparently there are fees for when you need blood transfusions. So the major difference between the plans is what Company X and Company Y charges you for them, because Medicare says an A is this, a C is this, a K is this. And so it's just the business model. It's why, you know, whether you shop at Costco or BJ's or your IGA store right here, it's, you know, they set the prices, and each business makes their choices on how to price them. So Company X charges $150 a month. company Y charges $200 a month. It's the same coverage, it's just different business model. And the information that we give you that in that book that I talk about explains why. They talk about community rated, age attained. There's different reasons why they would price them the way they do. It's the exact same coverage, and here's the chart. This is on page 72 of the 2021 handbook that you're holding. This exact chart is in that booklet that Tom handed out. So if you are already 66 years old and thinking about Medicare, you're still allowed to buy this plan, Plan F, but it's no longer being sold to anyone turning 65 this year. The next plan that has the most comprehensive coverage is the Plan G. And there's an asterisk on this chart, and over here it talks about this. The asterisk means it comes in a high deductible option as well as the regular option. So this talks about what the coverage is. So a Plan A is less expensive because it has less coverage. The Plan G covers almost everything except the Part B, and you may or may not remember from earlier in the presentation, the Part B deductible is $203 a year. This is a chart that shows you what the companies charge for these plans. So again, you can see A, B, C, D, F, G, okay? It's all organized here. Shows you the name of the companies, and I brought these charts with me. They're on the back table for you to take with you. Anyone on Zoom, I will be emailing this information to you at your request. So these are the companies that sell the plans, and this is what they charge. I know this is probably far away for the live audience here. The people on Zoom can probably see this information easily. Let me see if I can. Oh, I can. So I had mentioned the average cost of these plans is $175. And those are the names of the companies that sell them. And so you can see here the plan that's highlighted. One company charges $214.29 and another company charges $196. So same coverage. American Progressive charges $266. So my apologies, now I can't get this screen to shrink. Okay. So, recapping the Medigap, you have 6 months, they call it guaranteed issue right. So you are guaranteed to be issued a policy of your choice when you first join Medicare within the first 6 months. If you choose to purchase one of those plans, you can have any plan that you want. It's designed to pay your out-of-pocket costs that you would normally share with your insurance. They're standardized. You select the plan that works for you based on the coverage. One of the plans is exactly the same, except you pay a $20 copay. So one plan pays the bill for you, another plan, lower premium, you pay a copay every time you go to the doctor. So the supplemental plans are secondary to Medicare. If you go into any facility, you give them your Medicare card, you give them the supplemental card, you're guaranteed to have the bill paid. It's not a network where they say, I'm sorry, I don't accept that insurance. If they accept Medicare, they also accept the supplemental payments. At the bottom of this slide, I have a note that Vermont is one of the states that protects you, the consumer, from balance billing, which means they have to accept what Medicare says is the approved amount. So if their bill says $220 and your 20% share would be $40 of $200, not $220, because Medicare says we're approving $200 for this service. This is another chart, a little simpler and larger for you to see. So most people can no longer buy the F plan, so I blanked that out. This talks about the coverage levels of the different plans. I have the pricing chart. I have the handbooks there, so you can compare prices and coverage options if you're interested in buying additional insurance. So, talking more about the Medigap, anyone with Part A and B can purchase Medigap insurance. It does not apply to anybody that wants to go into the Advantage plan model. You cannot buy additional insurance. You accept the terms of the Advantage plan. So an Advantage plan might say you have a $35 copay when you go to the doctors. No matter what the cost of the bill, your share is $35. You cannot buy supplemental insurance to pick up those extra costs. So Medigap open enrollment period begins when you enroll in Medicare. It's that guaranteed issue right of 6 months. You cannot be denied. Can you enroll in one of these plans anytime? Yes, you can, just like your homeowner's insurance or car insurance. You can contact other companies. You can enroll at any time. It just, you may not be guaranteed to purchase the plan that you would like to buy at the price you would like. And Medicare also allows people who are younger than 65 to purchase this insurance, but they do price it differently. If you're eligible for Medicare, so younger disabled individuals can also buy the insurance, but the pricing is different. It's higher. Once you turn, so if you're 47, you're disabled, you're on Medicare, and you don't buy supplemental insurance during that time because the price is higher, it's $300 instead of $198. When you turn 65, you're in a new enrollment period. You can purchase insurance just like you're brand new to Medicare. So a lot of people do not necessarily realize that. So there are financial assistance programs available. You're looking at me and saying, I'm on a fixed income, how can I afford all these things? Folks that are on a fixed income, usually under 225% of federal poverty level, that's a whole different topic, but that's how they determine what the income eligibility is. They use a federal poverty level figure to determine if you're eligible for assistance. Federal poverty level, by the way, is about $1,100, so it's 225% of $1,100 is how they get that calculation. We talk to you individually about, so we ask personal questions sometimes in our counseling sessions. What is your income? Are you married? Are you single? Do you have a pension? So we help you figure out if you're eligible for any financial assistance. There are federal and state programs that offer financial assistance. The basic one is low income subsidy. That is for individuals to help pay for their drug coverage. There's Green Mountain Care. Many of you may know it as Medicaid. The Medicaid office, the Green Mountain Care office, offers state pharmacy assistance program, offers Medicare savings program, and then also offers community Medicaid. So the low income subsidy through Social Security, it's for the people with the lowest income, and for an individual, low assets would be $15,000 or less. You pay no premium for your drug coverage, and you have very small co-pays. There is an option for people with higher income and assets. You pay a reduced or no premium, lower deductibles, and lower out-of-pocket costs. So the federal assistance programs, this is the income level for people who could get help paying their premiums. Very lowest income, like I said, $1,100 is technically $1,084. Then there's a income bracket of $1,296. These are figures for individuals. So if you were an individual living on your own, widowed, divorced, single, and your Social Security benefit is less than $1,456 and you have no other income, you would not have to pay your Medicare Part B premium. That's a really important thing. I have, in my years, encountered people who have declined Part B because they didn't think they could afford it, because they didn't know there was help to pay for it. So it's the phone call to our office is really important to make sure that you're not being overcharged for your insurance. So these programs offer limited Medicaid benefits because the Medicaid office will pay some or all of your premiums. And here's my plug, call us to discuss your eligibility. So this is a slide that I introduced myself with before Zoom was up and running. We are part of the SHIP network, the State Health Insurance Assistance Program. We're here to empower and educate you. We offer free and confidential insurance counseling. Most of it is done over the phone because we can talk to you about this as long as you have the handbook, computer access, or we mail you documents to look at. So the pandemic has not put many challenges in our world. We have been able to continue the work we do over the phone. This is my first outing in 18 months in terms of we used to do these classes on a regular basis, and for the last year we've done them over Zoom. So thank you for hosting us and being the one to break the ice. So our local number is listed here. We're at 885-2669. The statewide number is also here. And this is what we do. We are happy to advocate for you. We help you understand and connect to the federal and state programs available, and we help you pick the best prescription drug plan for you, and we will do that every fall for you. So another thing that we do in partnership with the Senior Medicare Patrol is to educate people about fraud and abuse. And there is a difference. The Medicare abuse is when you get those phone calls offering you something, you just need to provide your Medicare number to them. You don't want to be doing that. So the difference of whether it's fraud or abuse is the intent. Medicare fraud is purposely billing for services that were never given. One thing that is done, Medicare does to help you monitor fraud is they require and they provide you, it's called a Medicare summary notice every time your number is used to bill. You get a detailed summary notice of what was billed, and I have spoken to people that said, I never received that, and that's a fraud.
I'm sorry, I did that and then I called, and then I was like, oh my God, yes I did. It was something.
But it shows that you're looking out, and and it, that's, so, it was called this, but it was really that, or something, Yep, so it doesn't hurt to check and make that phone call. So we work with a volunteer organization called the Community of Vermont Elders. I have a little video here, but I haven't figured out how to get the audio on it, so I'm not going to play it. But that little video sort of talks about what the Senior Medicare Patrol is. They disseminate the fraud and information. They have some wonderful YouTube videos, little role play skit things that say, oh, I could, it's fun, an educational way to learn about your Medicare benefits. So these are the resources available to you. the SHIP counselor at your local office, your handbook, calling Medicare, using the Medicare website, and the phone numbers again for the Rutland office and the website. So this is another video that I put up here that I really enjoyed. It's on YouTube. If you were to type in SHIP Technical Training Center, they posted all of their sessions from their most recent virtual New to Medicare Fair, kind of like this. That was the SHIP leaders in each of the states sharing a session like this, and I found this particular video, which I think is titled "The Difference of Original Medicare and Advantage Plan." It's a great video that if you're into going on YouTube, just look for the Technical Training Center channel, and they've got some great videos up there. And so let me see if I can put my group, stop sharing my screen, because that is essentially the end of, okay, hi everybody. So I am open to, I guess, I'm sorry, I don't have a chair to sit in or whatever, let me.
Would you like one of these?
Well, it looks like I've been the headless, just seeing the, so I'm going to open it up to questions that I can try and answer, sort of roast the SHIP counselor. Let me check. I'm tethered to the thing. Let me just check the chat screen that people, so, oh, lost video.
Audio's not good.
Did we got it back? Okay, audio's not good. My apologies. Fix the audio, not great. So, I apologize about the poor audio. No, so when you, Sherry, you asked the question, do you know what Medicare? All you want is to enroll in Medicare, and then Social Security will often direct you to us to pick your best plan. So you enroll in Part A and Part B with Social Security, and then you're on your own after you get the card that tells you what your number is to figure out your other options, and that's where we come into play with guiding you through that. Yep, and it's really based on the medications you take and your budget and what type of coverage you're looking for. Got like left and right. What did I talk about that I seemed to go too fast and you had follow-up questions? Is there anything?
I was hoping to hear a little bit more. I'm in the original Medicare now, and the prescription drug and all that. And I'm thinking of moving over to the Advantage plan, and I'm not really sure how to choose.
Okay. And so that sort of piggybacks on the question at the beginning of the session. We had, before Zoom was connected, I think, we have a retiring teacher in our audience, and the state employee retirement system has notified all those retiring teachers that they're going to be offered an Advantage plan. And so that's a very similar question to her, is how do I choose? And you know, what's the difference? And so how do you choose is a two-step process. the different insurance companies have different coverage for the medications you take. And so you might love the benefits and maybe the gym membership and maybe hearing aids are covered on one plan, but the coverage on the medications that you need isn't so great. And so we try and fit those together. So the Advantage plans, some of them offer gym memberships, some don't. Is that important to you, or have you never stepped foot in a gym and don't plan on it now? Some of them have a large network and some of them have a small network. So is my doctor, is my dentist, is my eye doctor in your network? If they're not in your network, are you willing, if they're not in the network for that company, are you willing to change doctors? That's something we often heard about with the Affordable Care Act, and I don't want to change my doctor. That's our right. And so finding a company that has your providers in it, and will that work for you? So under the Advantage plan, you have specific sort of dollar amount assigned, like a co-payment for a specialist is $35 with one plan. With another one, it's $45 for the plan. So one plan covers chiropractic care. Another plan considers it, the chiropractor is a specialist. So your fee to see a specialist is higher than your primary care doctor. Preventative care is free. If one plan considers chiropractic preventative, then it has a lower cost than the other plan. So looking at what's important to you is how you decide, and a conversation with us helps walk you through that, finds out what's important to you and points out, what this plan offers. So all your choices are in that booklet that just arrived in your mail, but it's not very informative. The Medicare website and the company itself has a very detailed list. The chart in the book talks about what they'll charge you and their basic coverage, but it doesn't give you specifics like the preventative care versus a specialist and things. So the book is very helpful as a starting point and to give you a quick rundown of the 19 different choices and how they stack up to each other, and then you start to narrow it down through a personal conversation with one of us.
Thank you.
Thank you.
You're really informative.
When it comes time to determine if we are eligible for financial assistance, let's say we would be receiving Social Security, but also getting money from a pension fund. How is the income calculated? Is it a percentage of what we have totally in our pension fund, or is it the monthly
It's what
amount?
so it's monthly income. So my Social Security benefit's $1,200. My wife's Social Security benefit is $1,320. My pension is $420 that I'm getting every month. It's what the monthly thing. So it's the same if I'm working as a single parent with 3 children and I apply for fuel assistance to the state, they're going to ask me what my monthly income is, and they figure that out by looking at 2 of my pay stubs, which is a 4-week period snapshot in time. So it's the same with your Social Security and pension is considered unearned income. It's not wages, but it's something that's coming in every month.
So if you decide not to have any money taken out of your pension and just live on the Social Security, they don't look at the pension at all?
The pension sitting there is a resource or an asset. And so on many financial aid applications, it asks you for your resources as well as your income. And some applications, or programs, I should say, some programs consider your resources and some don't. The premium assistance program, that Medicare savings that had the $12.96 and the $14.56, and I said it would pay your Part B premium, they don't, in Vermont, they don't look at your resources for that. So therefore, you're not penalized for saving for a rainy day.
Okay.
So when you start collecting a pension or a 401k or an annuity, that is income. Anything that's coming in every month on a regular basis, whether it's earned or unearned, is income.
So they wouldn't look at savings either?
That's a resource. It's sitting in the bank for a rainy day. It's available to you if you needed it to fix your roof or whatever else. But if you're not drawing out $500 from it every month, it's a resource. If you're taking out $500 from your $200,000 savings account at Heritage Credit Union, that's considered income. Yeah.
So car breaks down, it's gotta be replaced, all of a sudden, we gotta take a big chunk of money out of savings to
Right.
replace the car.
That's not income.
That's not income.
Right.
Thank
I
you
mean,
very much.
Yeah, you're very welcome. Yep, and so I'll just put a plug out there. We're starting the fuel season, heating season, buying our fuel. Any two-person household that has less than $2,600 a month, it's actually like $2,669 or something like that. They change the figure this time of year every year. Any two-person household that has less than $2,600 a month is eligible for federal fuel assistance.
Did you write it down?
So a lot of people don't know that. So $2,600 is kind of the magic number for fuel assistance. They will help you pay your fuel bill for the heating season. And I have some of those applications here. So I brought a little bit of everything from our storage closet because it's not doing any good in our storage closet. I want you to take it, read it, enjoy it, learn from it.
What is the phone number down to Senior Solutions?
So you can reach us by calling 802-885-2669. And on the back of that handbook you have is the toll-free number that's statewide, 800-642-5119, somewhere on there. And that will reach us as well,
Okay.
if you're calling from a local. So if you're calling from a cell phone that was issued in Massachusetts, it won't reach us directly. It'll actually reach our Burlington office, but it'll get you sort of where you want to be.
Okay.
Yeah.
Would you give those numbers again?
Yes, the number for Senior Solutions, 802-885-2669. One of the things I brought are magnets that have that number on it. So feel free to take a refrigerator magnet as well. So some of our online audience, are there any questions I can answer for you? Oh, it looks, okay, I'm just reading it now, sorry, Gail.
Please go to the chat.
Yes, so if you're calling for a consultation, what information should you have ready? Your Medicare number is what we use to help you enroll in a plan. So whether or not you have the card, whether or not you have made the call to Social Security, that type of information. After that, it's what medications do you take? What's important to you? What's your budget? So it's general until we start looking at narrowing down drug plan options. So do you take lisinopril 20 milligrams? Do you know, what is the medication that you take on a regular basis? And we will help you figure out the plan that's best for you. So new to Medicare starting in January, we would like to get you some general information, but we probably would schedule a time to talk to you in mid-December after the open enrollment time, when you need to make a choice for yours. So we're doing very heavy call volume between October 15th and December 7th. So it's important to make sure that when you schedule an appointment that we know that you're not in Medicare, you're starting Medicare. That's, I guess, an important piece of information to share. Husband taking Social Security in January and will be covered by work plan until June. When do you sign up for Medicare? You should sign up for Medicare. Part A is free to you, so it's a good idea to sign up for it when you turn 65. Sherry, taking Social Security in January, is that when he turns 65, or is that based on a full retirement? You're welcome to unmute yourself and talk if you want. Oh,
Okay, how's that?
that
Can
is
you hear?
good. Yep.
Yep. I'm sorry, so the question is, what?
So is your husband turning 65 in January, or that's just when
He'll be older than that.
Okay.
We're talking about me, so why don't I interject here? I'm Sherry's husband. My name's Brian. Can you all hear me?
Very well, yes, the volume's very good.
Good. All right, I didn't mean to shout. I'm sorry. I turned 70 in January. We got Part A when I turned 65. I signed on for Part A, but not Part B because I'm still on my employer's insurance, and will be on the employer's insurance until the end of June of 22. But I turned 70 I will turn 70 in January. So Sherry's question was, under those circumstances, when do we sign up for Medicare? Do we do it when we sign up for Social Security, or do I wait until some period of time prior to when my insurance runs out in June?
That is a very good question, and that is really based on the insurance options you have available to you are Medicare and your employer's plan. And it would be interesting for you to compare the cost and coverage of your employer's plan versus Medicare, because like
the employer's plan is not going to cover me starting July 1st.
Right, so you want to enroll in June, or you want to enroll before July 1st, and that can take a four weeks for them to process the enrollment. So so I should allow a month, at least a month before my insurance runs out to enroll. Yes.
Okay.
And we can sign up for Medicare like 3 months before the end of June. I mean, we could do it in April or May.
I tried. Okay. Yes, so you would just, there's a form that you have to fill out that proves that you have had coverage, and you ask for when you want coverage to begin.
Okay.
Yep.
Thank you.
Yes, you're
Thanks
welcome.
very much.
You're welcome, Brian. Anybody else?
Yes, I have a couple questions. In the very beginning, you were talking about if you've received your Medicaid card in the mail.
Yep.
Does that mean that I am already signed up if I receive that, so I have to do nothing?
Correct. If it says Part A, Part B, effective date, you have to do nothing other than decide about prescription drug coverage and whether or not you want supplemental.
Okay, but what if I choose not to have Part B?
They should have included instructions. You, I believe, sign a form and return the card,
I don't remember
and
that.
they reissue you a card.
Okay.
Yep.
So I have to do nothing unless I don't want Part B, and then I have to fill out a form that says I don't want it.
Correct.
And also, we're covered under Green Mountain Care,
Yes.
which pays just about everything.
Yes.
So do I really want Parts B and D and all that?
The answer is you need it because you're only continuing coverage, most likely. You're describing a scenario that has happened many times over the past year. When you are turning 65 and you're covered by Green Mountain Care, you're supposed to end your coverage with Green Mountain Care and pick up Medicare at your 65th birthday. But the pandemic has kept people on longer than they should be because of the rules around no adverse changes to people's health coverage. So that would be a very good phone call to our agency to talk about whether or not you can continue to get help from some of the state programs to pay for your coverage.
But I'm probably gonna lose my Medicaid then, at some point.
Yes,
Okay.
depending on your income. So that's where I want to say let's keep it general here
Right.
and not reveal too much about
Right,
your
yeah,
personal
okay.
situation.
So definitely call up and schedule
But the,
something.
yep, so what happened with the Affordable Care Act is that the income eligibility for regular folks like you was expanded. They talked about expanded Medicaid, sorry. So Medicaid is for the lowest income individuals primarily until the Affordable Care Act. And then the eligibility went from that 1,084, the federal poverty level, up to like 1,700.
Okay.
But the Medicare people, their income eligibility didn't change. So there's this whole pocket of people that kind of fall off a cliff where they go from, I've had free insurance because of low income, and now that I turned 65, you're telling me I have to pay $148.50 plus approximately $33.60, that average
Right.
Part D. Wait a minute, I go from paying nothing to paying $175. I can't afford that. And then they start declining and whatever and run into problems. So you're kind of giving a scenario I deal with a lot.
Okay.
And so I say, well, there are financial assistance programs available. So if your income is less than $2,400 a month as an individual, Green Mountain Care will pay your premium for your drug plan. If you have low resources, Social Security might help you as well.
But they won't consider both of our incomes? They consider individual me and individual her?
No, it's a household.
Okay.
Yep, but because of the Affordable Care Act, they expanded, Vermont was one of the states that expanded Medicaid eligibility to give more people health
Okay.
insurance. So it used to be if your employer didn't provide it and you were working, you had too much money for Medicaid, but not enough hours or not a good enough employer to get benefits, and you were left in this quagmire.
So if I were to call up tomorrow to schedule an appointment, how far out are you on appointments?
We're about 5 days out right now.
Oh, that's okay, a week, that's
Yep.
not. Okay.
Both of us that are offering insurance counseling work 4 days a week.
Okay.
So there's one day that she works and one day that we alter. So it's Wednesday and Friday, there's only one of us covering the appointments. So if you call on a Friday, you might get bumped to a Thursday.
Yep.
If you call on a Monday or Tuesday, we might talk to you on Thursday as well.
Okay.
Yeah, so if you're getting our answering service, you want to leave sort of as much helpful information, like I attended the seminar the other day. You know, I have my Medicare card and I need to find out about a drug plan.
Okay.
So
But you're only doing it on the phone?
we mostly do it on the phone because it's really computer based.
Okay.
We do our research on the Medicare website, and so a few people I've taught them how to do it over Zoom, which is kind of cool. But with the pandemic, sitting side by side to
Right.
look at the computer,
Yeah,
and
right.
I can talk to you on the phone just as easily as we can do it in person. We just make sure you have all the literature available.
Mhm.
Yeah.
What was your name?
I'm Sarah.
Sarah, thank you.
So it looks like we've lost our Zoom, either the scheduled meeting ended or people,
Left.
yeah, so,
Okay.
so that's my little
Thank you very
Pardon,
much.
pony show.
Yeah, that was great.
Yep.